Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today, I've got a guy on here. I'm going to have to give you the history of him. It's Dr. Randy Pardue, who I've been wanting to get on this podcast for a long time. And finally, today, I've snagged him. He's a really busy guy. He's, in my opinion, the best family doctor in Knoxville and far and wide. It's interesting because we grew up in the same hometown. Mm-hmm. He was actually my brother Bob's roommate for 8 straight years. 4 years at UT, 4 years at UT Memphis Medical School. So our families have been intertwined for many years, and certainly I have a lot of respect for Randy. We're kind of on the same page with both being family doctors for so many years, and you know, he has really gotten a lot into the functional medicine side of things, and owns his own gym where he works with Parkinson's patients, and he has a real interest in brain health and all. And we're going to do a thing about dementia, taking care of your brain, on the next podcast. But I really want to talk about, first of all, medicine in general. How, you know, we've been in it a long time. I think I've been out in practice for 38 years. You're right behind me in that. You're a little younger than I am. But, you know, why did you get into family practice? Because literally you're a guy that could do anything you want to do. And how has it evolved over the years? Give me the temperature of our medical climate as you assess it.
Well, as far as family medicine, I just love the idea of taking care of babies all the way to elderly, and I love the idea of taking care of whole families. So, and basically that's the relationship. It's just really getting to know everybody in the family and following them over the long term, and just dealing with all their problems and you know, not emotional problems, relational problems. And then obviously chronic medical problems, and so that was sort of my first draw into it.
Mm-hmm, mm-hmm. You've certainly been successful with it, and I'm like you, and I talk about this all the time. Half of what comes into my office, it's psychologically based, mm-hmm. And you know what I've learned is that you're right. To be an effective primary care doctor, you have to get to know the person very well. And if you get into this field and you don't like doing that, you're in the wrong field. You better go into some other specialty, because it takes a lot of getting to know people, empathy, and realizing that, you know, the shoes that they walk in are very different than anybody else's, including your own.
Yes.
But there's a lot to that psychosocial model to medicine. And a lot of my patients have undergone early childhood trauma mm-hmm. that later manifest as real disease. I often tell people what goes in early goes in deep, and a lot of times it's the challenge to get to it. And certainly we're not psychiatrists, right. But we're the first line, and if we don't recognize that, nobody's going to recognize it. And a lot of times that's how you're going to help them the most, is help them sort that out. So being a primary care doctor is not easy, for one thing.
Right.
You know, you have to know a lot about a lot of different things. I mean, you're mm-hmm. taking care of babies up to elderly. Again, I don't see children anymore, but it's not an easy job.
No, it's not. I mean, it's you know, long hours, but again, the reward does come in the relationships and knowing people. And so I've been at it here in Knoxville for 34 years. You know, we planted our practice in 1990, and have had almost every day, it seems like someone tells me they were there from the beginning. So I love that part of it, and the trust that it builds. And of course, now everybody's asking me when I'm going to retire. So,
me too.
But I tell them I'm hanging in for a while, because I still love it. But yeah, that's just the long-term relationships.
I agree. It's very rewarding. It's satisfying. You're really helping people in a lot of ways. How, not to get too controversial, but how do you think medicine has changed since we got in it many years ago, decades ago? How do you think it's evolving as far as patient care, primarily primary care?
Well, I think primary care is slowly evolving in the direction of what I call functional medicine, which is root cause medicine, and we can say more about that in a minute. But but I think it's slowly evolving, and both you and I have practiced that way for years, and but the way I would describe it is being trained in the traditional method, and now I'm really thinking about chronic illness now. Metabolic disease like pre-diabetes, diabetes, those sorts of things, is we were trained to look at numbers, so to look at a cholesterol number, a blood sugar number, a blood pressure number, to look at those and basically to treat those numbers, so to lower the cholesterol, to lower the blood sugar, to lower the blood pressure. And what I call that is sort of like pruning the branches rather than treating the roots of the problem. Mm-hmm. And so functional medicine, lifestyle medicine says what is causing that, for example, insulin resistance, mm-hmm. And then getting in and pulling it up by the roots.
Yeah. So finding the base cause of it, which is a lot of times is nutritional. Yes. Lack of supplements. I know you do a deep dive with some of your blood work like I do, but you're exactly right. I think as doctors, especially as time has gone on and there's more demands, more codes to look up. Of course, I'm a cash-only doctor. It's way easier for me than it may be for somebody in a traditional type group practice. But a lot of times, don't you think that doctors are encouraged to just write a script and get out of the room and not address the root cause?
Unfortunately, yes. And I think that's just the nature of how medicine works, is that there's a time element for us to see a lot of patients fairly fast. And so that then leads you to want to do the quicker thing, which is to write the prescription. Because lifestyle medicine, even though we know it works, to get it to sink in, to get a patient really to do it, to change their lifestyle, is, as you know, is not easy, and it requires coaching, it requires time.
Time, and it's not really rewarded so much through reimbursement. I mean, you're really more rewarded by turning patients over and finding codes for different diagnoses and things like that. It's even getting worse, I think, because of pay for performance, where you need to have most of your patients on certain medications because you're almost judged by that.
Yes.
And their numbers. If their numbers are looking better and you put them on 3 medications for their blood pressure, their cholesterol, then their diabetes, then you're actually looking good, and reimbursement-wise and every other way, when really you haven't helped that patient out at all because they're still obese. They're tired. They hurt all the time.
Yes.
And it's really not solving their problem.
Right. They've got a cabinet full of medicines and identify as a sick person.
Yeah.
So I am a chronically ill person, or I have diabetes. That's how they identify, rather than I'm a healthy person,
Yeah, that's how we, as doctors, sometimes that's how we refer to them. This is a 35-year-old diabetic, and really, you're right, we're putting labels on them when they're just a person that really is seeking our care to live a healthier life. And a lot of times I think we're doing a disservice by putting them on so many medications. I think the first half of my career, I was prescribing more medicines than was necessary. The second half, I've been getting them off the medicines. Yeah. And really, I was never really taught anything substantial about nutrition. I learned that on my own when my own 2 children came down with type 1 diabetes. And then a light bulb turned on, and I started thinking, golly, I'm really practicing the wrong way. Then I went the functional integrative route. I know we've been to conferences together decades ago,
mm-hmm.
and we've always been on the same page, but unfortunately, we're kind of rare. There's not many doctors like that around. I'm not tooting my horn or your horn, but it's just harder.
It is. It's harder and harder to get reimbursed, and that's why we started the branch of our practice. So I'm with Trinity Medical, but started Vital Wellness.
Yeah.
And that was because it's a cash only part of the business that then allows us to have tools and such to do all the things we need. So, we do coaching, we have group instruction, group exercise, and it's also sort of a lab for learning, how to help people change.
I love your gym over here. It happens to be right next door to my Knoxville office. And now they're building a pickleball court, which is even better.
Isn't that great?
We're going to have it all.
Yeah,
I play
I know.
pickleball all the time. But yeah, I've always admired you. You've been doing that lifestyle exercise coaching for years. I don't know of any other doctor that does this like you do. I mean, you really present the complete package, and you're able to practice in a fairly traditional medical group as well. So you're really bringing it from all aspects. So my hope for you is that you can convince a lot of your patients that come in for traditional care through the insurance model to really realize that, hey, that's not really all you need to be doing.
Yes. Yeah, and that's been a journey. I mean, because when people are locked into that insurance model, their first question is, well, does insurance cover it? So it's been a journey learning how to sort of explain to patients, why it's worth it to go that route, and that I'll stick with them as their traditional physician, but I'd love to help them on that side of it too.
I love your aspect on that. I'll tell you a couple of things. One is I had a patient the other day that had been to their family doctor, and this was a very inquisitive patient. That's why she comes to see me as well. But she asked that doctor, who's been practicing many, many years, how he kept up with all the new stuff in medicine. And he was very honest. He goes, the drug reps. That's honestly, and that was an honest answer, but it's kind of a sad answer too.
Yes.
I think they almost make up diseases to make a new drug for it to make money. Unfortunately, medicine is big business now, and
it is.
There's a lot of things you have to be careful about that. But the other thing I wanted to tell you about is, you may have read this book, Dr. Marty McCary at Johns Hopkins. He's a surgeon, but he's also he's a very learned intellectual. He's at the top of the academic world. I think he's had more medical articles published than almost any physician out there. But he wrote a book called Blind Spots, and it talks about cognitive dissonance, which I talk about all the time, which is just what you were talking about. Doctors are slow to change. They practice the same way they learned it in their residency, and they're so busy that they never learn new things and integrate that into their practice. But that's a great book. I'm going to link it up to this, 'cause I'm always talking about it.
Yeah, I haven't read that one. I'll have to
check
it out too.
Great. Your wife, Jean Ann, may be interested in this book too, because she's a pediatrician, a great pediatrician. He talks about examples of cognitive dissonance. Like, for example, years ago when they told babies or infants not to be exposed to peanut butter until age 3, guess what happened to the anaphylactic reactions to peanuts in kids? It skyrocketed.
Yeah.
So that was a bad recommendation, and it took decades and decades for them to admit it. And now, of course, they want to expose that kid to peanuts early on in their life so they won't have this reaction.
Yes.
Another example he mentions is the farce that was called the Women's Health Initiative, that led a whole generation of women to be scared of hormone replacement.
Yes.
When it's so beneficial to these women. But he gives a lot of good examples about how in medicine it takes so long to change the mind in light of evidence that this is the right way to go.
Yes.
I don't know if it's because of obstinance or what, but what's your theory on that?
Well, maybe I don't know that it's obstinance as much as just that you're locked in on you were trained in that understanding, and it's just very hard to get away from it.
It's dogma to you.
Yeah.
Yeah.
And also the other thing is you have to see some of this happen. So like reversing diabetes, So we know now you can reverse type 2 diabetes. And we've got numerous
Absolutely.
patients that were their A1C, so their number that shows 3-month control of blood sugar went from 9 to 5.5. We've got lots of patients like that, but it's interesting that we can have a whole lot of patients like that, yet a lot of doctors still believe it can't be reversed.
Yeah, I absolutely believe it can, 100%. So medicine's changing. My advice to people would be to look after your own health, do your own research, see how you feel, get a doctor that will listen to you, and try to find the root cause. Anything you would add to that?
Yeah, and just be aware that even though lifestyle changes are hard, so changing your diet, reducing the amount of sugar you consume, adding numerous the multicolored vegetables to get what we call phytonutrients. All those things. It's hard, but once you change your habit, it's not hard. And you can eat delicious food. You can. It's not like you're eating rabbit food. You can have meals you look forward to, and it be perfectly healthy.
Yeah,
So.
yeah, and you'll feel so much better. I guess you are what you eat. But I've always said, nutrition, exercise, sleep, stress, and then evaluate your hormones has been the basis of my whole practice for many years. But anyway, Randy, it's so good to have you here today. Thank you for sharing your insights to us. And we're going to do another podcast on your interest, which is dementia. So we'll see you guys next week.
Thank you so much, Tom.